I'm just really thrilled and honored to have Dr. David Szpilman with us today. He is probably the leading international expert on drowning. I will say he is one of the most widely published and researched physicians in drowning. He is the Secretary-General of the Brazilian Life Saving Society, Sobrasa, and has done some really impressive work in Brazil. We're so excited to have him here today to share his expertise with us and some of his learnings and experience with drowning prevention and the work that they've done in Brazil. So I will turn it over to Dr. Szpilman.
Hey, thank you, Dr. Tracy. And I have to excuse myself because I thought it will be a 15 minutes presentation, different presentation. So you guys will maybe have access to another presentation previews, and it will makes more sense if I start with the 15 minutes left. So I will share my screen and go for it. So our main prevention, or our main tool is prevention. We have this motto which calls to prevent is to save, educate, not to drown. This has been a mission for myself for this last 15 or 20 years. And I have been involved in drowning definition, the change of drowning definition to ruling out the near drowning terminology and start to using drowning as a the unique terminology, and drowning fatal or non-fatal drowning. So drowning is the process of experiencing respiratory impairment from submersion, immersion in liquid. It means that a child can be in a bathtub and slip away, and if the child goes only with the mouth or the airways underwater, or just a splash on the mouth, this is a drowning. Drowning starts when the aspiration of liquid starts. The outcome are classified as death or survival, as I told you. So we have to mention that drowning can be fatal or non-fatal. Contrary to what we usually see at the hospital, only less than 6% of the drowning person goes to the hospital. So there's a large people, 94% of people who struggles, who aspirate water, are left before hospitalization. They are cured or they are treated not at the hospital exactly. So when we see a drowning, it's very interesting and very important to differentiate it from a rescue person, which is a person in water distress without coughing or with normal pulmonary auscultation. So there is two different things on drowning, which can be caused by a primary cause or without any precipitant cause, or can be caused by drugs or convulsive crisis or a trauma or diving, any situation that put the water competence a little below the risk of that environment or that activity. So the process of drowning starts when people are in the water, of course, but it starts with the first aspiration of liquid. And it's very important to understand that drowning has three usually figures or features, which is it's very fast, very silent, and it's very critical. It's very fast because a person can be join the water and start to drown in 10 or 15 seconds. It's very silent because people cannot ask or call for help because they are struggling with their respiratory insufficiency or failure, and they are unable to scream or call for help. They are unable to wave for help. So it's very quick, very silent, and usually very critical. What does mean is that someone is start drowning, and in 2 minutes or 3 minutes, there is a cardiopulmonary arrest. So it's very fast. So having in mind these 3 features of drowning, we can understand how they can be a rescue and goes quickly on becoming a drowning aspiration, became a very small aspiration, grade 1, and this in a second and a third aspiration, it becomes grade 2, and it's a little how to say, a little foam on the mouth. The pulmonary auscultation is crackle on both lungs, and then quickly in seconds, for more 1 or 2 aspiration, they become a grade 3 or 4, which is acute pulmonary edema. It's where the PO2 is getting down to a half of the normal value. Indication of ICU, a need for a mechanical ventilation, a respirator. So it's very quick. And if this person, which is a grade 4, acute pulmonary edema, if not rescued at that time, it stops breathing, stops conscious at the same time, and it become a grade 5. And then in a few seconds, 30 seconds to 1 minute and a half, the heart stops. And so it's very important to understand the pathophysiology behind those things, because the treatment it has to be made accordingly to these steps. So the most important thing is hypoxia, where in rescue there is no, in rescue in grade 1 there is no hypoxia. Hypoxia starts at grade 2 and then become more severe when is getting more and more aspiration. So this is an X-ray of a grade 2, where you can see a little hypertransparency at here. It's a very small water aspiration. This is very interesting and important to realize that this seems something like no more than 80 millimeters. And then you have an acute pulmonary edema, which is grade 3 and can be a grade 4. The X-ray is the same. There is a huge pulmonary hypertransparencies, and this only takes 2 to 3 millimeters per kilogram of weight, or less than a cup of glass to aspiration. So you can imagine that this is occur very quickly. That it not takes like we imagine in the past that it needs a liter or more to be a severe case. It's very small and cause a high damage on the lung. Usually our drowning or demographic profile is male, single. They used to think that they are swimmer or they know how to swim, and this is a tricky thing because as you see on this work we published at CHESS, that almost half of the people who drown at the beach thinks that they are swimmers. So it comes to our mind that this is a tricky thing for the drowning person. Almost all live out of the coast. Our data is almost about beaches drowning. Secondary drowning is only 15%. Alcohol user, and this can vary in different scenarios. And other thing is that is very important is we collect that almost more than 80% of the people who drown at the beach used to fed 3 hours before drowning. So when you go to manage their airways, there will be rice, there will be beer, there will be chicken, there will be almost anything that they could eat before the drowning stuff. And we were talking about very quickly about the drowning chain of survival, which is a call for action, which is to prevent is the most powerful tool we have. Then we have to recognize the distress, and it's not so easy that we usually think that is. People are usually not raise their hands. They usually are trying to not get more water on the mouth. So, but you need to recognize the distress in the water, to ask someone to call for help, and then provide flotation, which is a very different way to approach drowning situation. We used to think that we have to be in the water to help people. No, this is a very dangerous thing. From the 16 person that dies, Brazilian, that dies every day, 2 dies because they get in the water to help someone else. So what we ask people to do is to provide flotation, throw some flotation, call for help, and wait for the professional to come. And then you have to remove from the water. And if you only will removing people from the water if it's safe for you. And then after all, you're gonna provide care as needed. So the most important thing is prevention. And we elaborate at Brazil, in Sobrasa, Brazilian Life Saving Society, we have many prevention programs for kids, for pool more safe, basic life support for drowning, first aid, surf safe. We teach surfers how to deal with drowning, how to prevent, to rescue, and give first aid. We have multi-actions program, life-saving club, drowning campaign. For example, we will have the World Drowning Prevention Day at 26th of July. This is organized by the World Health Organization. This is a very important thing that you can join, everyone. We have, for interrelation with the kids, we have comic books, we have cartoon videos. So we have all the stuff to talk with the most important people that can multiply this tips, this prevention action, which is the children. And it's very important, as I said before, that you know how to recognize a drowning event and what would be the best way to help without becoming a second drowning person. So this is very important to teach children not to get involved in a drowning or adult, but the children, it's very, how do I say, it's more fragile than an adult, and certainly will die if they get in the water to help someone else. And in water, we recommend that if it's possible, of course, we recommend that if the person is a non-responder or an unconscious victim, you should do ventilation in water. This is a publication from 2004, and I'm sure that there is no other publication at that point. We save a lot of people. We teach surfers how to do it. if you wait to get it on the shore to do the resuscitation, you're gonna have almost all at grade 6 cardiopulmonary arrest. So we take away the airways, we open the airways, we give up to 10 ventilation, and if you are in this window of drowning from the respiratory arrest to the cardiac arrest, you are able to restore the normal ventilation, and you get at the shore with the people alive. Also, how to carry a person from the shore, from the water to the shore. It's very important to keep their gastric content on the way it should be stay, and not provoke vomit and more aspiration with food and etc. So let's give a look at what would be the steps we do as a lifeguards on the beach at basic life support. We check for answer, and then we place the drowning person with the head and trunk at the same level. We do not attempt to withdraw water from the lungs and airways. We check for answer. Are you listening? If not, open the airways, feel, listen, and hear for breathing. Ventilation is not present. We apply 5 ventilation and check for circulation. And then if there is no response to this 5 ventilation, we start CPR completely, or if there is any response, it's a grade 5. You don't need to do anything else. People restore the normal ventilation. The other side of the algorithm, we check for cough and pulmonary auscultation. If there is normal pulmonary auscultation on any cough, it's a rescue situation. If there is any cough without foam, it's grade 1. Small pulmonary crackles, grade 2, or acute pulmonary edema, grade 3 or 4. If there is hypotension or shock, grade 4, and if there is not, grade 3. For each of this grade, there is a prognosis, and there is a treatment appropriately. And it's very important that you have an attendance on the beach or the pool, or anyone who can make the attendance, but be sure that is usually involve environment which is very packed. For example, at the beach, we use a lot of helicopters because it's difficult to move with using an ambulance. And we usually use a rescue helicopter with a medical helicopter to bring to the drowning. We have in Rio the Drowning Resuscitation Center, emergency center, especially created in 30s to attend the drowning person. And for ending, I will ask you, what is the biggest challenge we face for prevention?
Okay. Jack! Jack!
I borrowed this video because it really tells you exactly what the challenging we face. We need to convince people that drowning can happen with anyone, any place. It only matters about it only needs to have some water. And it's very difficult to give our prevention programs or material or tips if the person on the other side is not convinced that he really needs this material. It's really a sale. So I convince myself that I'm a salesman. I'm selling tips and drowning prevention programs, and I have to convince them that they need this. And this is the very biggest challenge we have. To avoid this situation, a 9 years old boy drowned with persistent drowning or persistent encephalopathia, anoxia. After they have a barbecue, everyone goes to have a nap, and the boy stays at the pool and drown, and it's the life is over for him and for their family. Thank you very much. And this is a picture of myself in very early days in the Copacabana beach. I love to be on the beach.
Thank you so much, Dr. Szpilman. We really appreciate you sharing your expertise, and we will have about 5 minutes for questions or comments from the group. David, I don't know if you're able to share your slides one more time, but I was wondering for this group if you could maybe show that picture of the beach during your holiday time, and we could talk about that a little bit, because I think that was so powerful for us to understand the challenges that you face there in Brazil. And there was a question, yeah, that was a very difficult video to watch, I agree, and wondering if you have a link for how to find it online.
This one?
Yes. And then if you have a link, David, for that video, you could either put it in the chat, or if you wanted to send it to Alex and we can distribute it after.
Yeah, I'll send you. I don't have the link, but I'm pretty sure that Ali has the video.
Okay.
Maybe she can put it and share.
Oh yes, you sent that to us, so Alex has it. Perfect. Yeah, so just wanted you guys to get that visual. Dr. Szpilman has so much wonderful information to share with us. 15 minutes is like not even nearly enough time. Hours would not be enough time for him. So he has a presentation that he gave at the end of the first webinar with some other information about kind of the history of life saving in Brazil, and some more on the drowning chain of survival, and also a very difficult video to watch about some footage of an actual drowning event that he gave us some commentary through. So Alex will be putting both recordings on our project site, and so you can watch the end of the first webinar to see that material as well. And he shared that picture, which I think was really poignant for us to see. You know, there's such a huge amount of coastline in Brazil, and especially when there's holiday events, or he had a picture from the Pope visiting where there were millions of people on a beach. You can understand why he said an ambulance would be very difficult to maneuver through a crowd like that. And I think it's just so impressive with the work that he's been able to do, and really driving down drowning rates in Brazil over the years.
Thank you, Tracy. Can I ask people to open the video and we can do a photo? Saying we usually use this kind of hands up, and we're saying that stop drowning with only 5 tips. And we have 5 tips for pool, for waterfalls, for surfers, for kayaking, for waterfall, for flood, all 5 tips, only 5 tips. That it's a way that people can remember when they have to. So can we do a photo?
Everybody that can put your video on, please join us for a minute and we're going to take a screenshot. Okay, we'll give people a second to get the videos going.
Sorry to ask, but this will
This is
go
great.
all the way, all the world.
All the way to Brazil.
Yeah. Thank you.
Thank you, David.
Thank you.
There was a question in the chat for you. Could you walk through when exactly to start chest compressions in the process of resuscitation? The slide was excellent, but just trying to process the sequence.
When exactly we would start? Yeah. When you are in the water, no chest compression. When we get out of the water, you're gonna start chest compression as soon as you give the 5 first breathing, mouth to mouth, and there is no reply. There is no response from the victim. Any movement is a response. So that if there is no response, we start 30 compression. And we used to say that we only stop in the basic level. We only stop if you're tired, if you restore, if the advanced life support arrives. And you only do not do anything in 4 situations if there is more than 1 hour submersion, 1 hour. If there is any evidence of death, real death after 1 hour, like livid or decomposition or body rigid, something like that. And this is very important for us at the beach as a lifeguard chief, because we usually split from a rescue to a body recovery. So this is a very usual thing all over the world.
That's a great question. And as David was describing some with that rescue process and the pathophysiology of drowning, it occurs on a continuum from respiratory arrest to full cardiac arrest following drowning. And so sometimes it can be a little bit challenging when you're, first encountering a drowned person to determine where in that continuum they are. And so that's why we start with the, just like you would think of, for any other potential cardiac arrest or unresponsive person, you check their responsiveness, check their breathing, initiate the rescue breaths, and then immediately to compressions. We have had a lot of conversations where David and I are actually on a writing group, and there will be a focused update coming out probably next spring with AAP, AHA combined effort, looking at all of the current literature that we have on resuscitation. And so we'll be looking at some recommendations for untrained versus trained rescuers. David's team is a very elite lifeguard, life-saving force, and so they have a lot of advanced training in rescue breathing and airway. But for a layperson who maybe does not, they may go right to compressions if they do not feel trained or able to give rescue breathing. But still, for us to know as medical professionals that ventilation is vitally important. Okay.
Thank you.
Any last comments, David, for the group? Mm-hmm. Okay, thank you so much for joining us today, and we'll let you go back to your day and we'll continue on with the webinar. Thank you.
Bye-bye, bye-bye. Have a nice day. So I am I have been dedicating my life to drowning stuff, to treat drowning. And I have 65 years old, and I've been working for 40 years with drowning. And I have the opportunity to see the drowning happens at the beach or the pool. And until we get it on the ICU, and then all the follow-up from emergency department to ICU, or even to lose the person at the beach. So I have this opportunity to experience all the way of the process, and being in that process gives me the impression, or I am convinced, that the prevention is the right way to go through. And I've been working with prevention, especially prevention on drowning, by 10 or 15 years, and this is being very rewarding. And what I will give you a glimpse of what we are doing, what we are expecting from drowning. So this seems a real calm and real quiet situation, and not dangerous thing. A child is left at the pool with a little step, and then the child fell to a more deep in the way. And this is, it seems like it's only happens to a drowning, to a child on a pool, but this is exactly what happens in all the way, in beaches and rivers and waterfalls and floods. Is always somebody that it's unable to see the risk comparing to that person or for that person, and the person is left unattended because a pool is not a dangerous thing, and seems that we really need to rethink the way we see the drowning, because it's all the way about what is the risk of the place compared to what a competence of this person, or in this case, a child. So you can see in the back a person giving a talk with someone. Nobody, it's not that people don't care about, it's that people did not expect that this situation can happen in a very calm or low risk environment as a pool. You can see some management walking away, and you can see all the stuff or all the facts that exactly happens in any environment, in any water environment, with any drowning situation. And you can see also that this management of the building is walking, and you can see he will stop in some time and look at of what is happening, and he really don't believe that this can be a possibility. Look at that. You can see he is watching for a few seconds and cannot believe that this can happen in a pool. So it's very, very important for us that we have to realize that any environment, any water environment is dangerous for a person who cannot fool or cannot copy with this dangers present in the pool or in any environment. For example, if you have a child that can float, and this is a very tricky thing, because everyone thinks about, oh, I know my child knows how to swim, so he cannot drown. This is not a true situation, because we can see that they need to not only be coping this swimming thing, but also coping the risk of the drowning or the risk of the environment present. So, for example, for myself, I am a great swimmer, and I'm a surfer too. But if I am left on, for example, Nazareth beach, I will drown. So it's all about what is the level of the risk of the environment, and if the person is a little above the risk of environment, the drowning will not happen. But this same drowning can happen if you got unconscious, if you get a flu, for example, and your competence get a little low, and the risk is higher than the possibility of a drowning. Our planet Earth is 75% of water, so every day drowning is happening with more frequently way in every country. Brazil has a long beach coast with 8,000 kilometers, one of the highest rescues in the world. We have a very warm temperature all year round, so we have a great or a high problem. 10 persons drown and 1 dies every minute in the world. 16 persons die by drowning every day in Brazil. Brazil has the first, drowning is the first cause of death from 1 to 4 years old. Second, from 5 to 9 years old. Third, 10 to 14 years old. And fourth, 15 to 24 years old. So for us, our children, our young people are dying by drowning with one of the highest cause. And we know also that males drown and dead by 7% fold of females, which tell us something about the behavior of the person who drowns. As a little bit different from what we expect is that the highest problem in Brazil is not at the coast. We have a lot of lifeguards guarding the coast. The problem is essentially in the middle, in the Amazonia area, in the center of the Brazil, whereas the drowning occurs in rivers, lakes, waterfalls. So 75% of the death occur in fresh water, only 15% on ocean beaches. So the problem is a little away of our view, and it's very difficult to fight for this safety, because a person is left unattended without knowing the risk, without education on how to react. And this is one of our mission in Sobrasa, in Brazilian Life Saving Society, which is educate people to not drown. We expend in Brazil $300 million US per year on drowning death. So we are talking with the government, let's spend some part of this on prevention programs, and we will have a lot of life savers. So how we see the burden on drowning? We see that prevention is more important than rescue or first aid. But whatever people invites you to talk about drowning, they always want to learn about first aid or rescue, not prevention. It's a very common thing. And I like to show you a little research we made on and published on resuscitation about 5 years ago, which we we show that 99% from all 1,500,000 intervention by lifeguards, 99.9% was prevention action interventions, and only 0.1% was rescues, and 0.02% was first aid. Just to realize how important is prevention on drowning thematic. In Brazil, we are going to the right direction. You can see by this picture that from 79 to 2020, we are getting down the death by 100 inhabitants. So we are more and more making more prevention programs, more actions on prevention, highlighting prevention, and this is being very worth it. And although frightening, or all this numbers, the data is all it's frightening, it can frighten us. We see only 6% of all the problem. We only see the hospitalization and the post-hospitalization aspect of drowning. So we cannot measure the prevention actively or reactively, or how many rescues was made, how many professional rescues, how many lay rescues was made. So what we see the drowning problem is only a tip of the iceberg. And this, all the recommendation on treatment on drowning starts in 1971, which highlight that we should, on a guideline or on a recommendation, and we should warm the victim and remove wet clothing. We still do it. Aspirate the water by positioning the victim with the head lower than the feet. We stopped doing that 30 years ago. Stimulate the victim via rectal or oral tobacco smoke. Thanks to God, we stopped doing that a long time ago. Use the mouth-to-mouth resuscitation method. We still use it, and bleeding we stopped a long time ago. So this is in an era that drowning represent one of the most impacting way of die, and people are very worried about how to resuscitate this pathology or drowning. And this stuff, this resuscitation era starts in Brazil, in Rio de Janeiro, where we have many water places, pools and rivers, beaches. So we are very worried about that. This is a lifeguard tower in 1918. We are not sure about how the lifeguard get down to make the rescues, but this is the very first beginning of life-saving in Brazil. This is the first ambulance in 1930. Is a building, an emergency center created in Rio de Janeiro city just to attend drownings on the beaches. And this is a Schaefer maneuver in a real one in 1958 in Copacabana Beach. And this is the change. I mean, what we have in the past, what we have now. And this is a visiting of Pope in Rio de Janeiro in July 2013. There were 2.5 million people on the 4 kilometers of beach, 1.5 meters of waves, 145 rescues were made, 130 lifeguards were at duty, 3 ambulances, 2 helicopters, and 1 drowning resuscitation center, 37 medical attendants, and no death. And this is a very similar situation 2 years after in the same part of the city, where is a city holiday, and we have 3 million people, 1 meter waves, and 2,000 rescues recorded in one day. 560 lifeguards working, 180 volunteers, 5 ambulances, 2 helicopters, and 2 drowning resuscitation centers, all working to attend 135 medical people, and we had 4 deaths by drowning. So I ask you, what is the difference between the Pope visit at the same beach with the same hazard, with the same risk of the environment, and the city holiday, other than the Pope, of course? This is a very through us toward the very beginning of this talk, which is the people who went to see the Pope were dressed, did not drink alcohol. Their behavior are different from this one, which went to the beach to go to the water, to improve, to have pleasure, and this is what we are talking about, is the behavior. The risk is the same, but the behavior is different, and this causes much more drowning to happen. So that's it for the first 15 minutes, and I hope we can do more in a few minutes. Thank you, Tracy.
Thank you, Dr. Szpilman. And we would love to open it up for any questions or comments.
Thank you, Dr. Szpilman. I had a quick question. That was great. Do the beaches, are they really that congested or that busy with that many people on the beach looking at those pictures? It seems like a ton of people.
Yeah, it's really something, because it only takes a sunshine day and a holiday one, and the beach is packed. It's Rio de Janeiro. It's very tourist. And a few years ago, I went to make a speech on Belgium, and I showed this picture, and they are astonished, because I say they realize that it will be all Belgian people on one beach. So so it's very impacting.
Dr. Szpilman, I think it's just so impressive, the work over time, seeing those drowning rates decrease with the implementation of Sobrasa and all of the work that you've done. I know you have a lot of educational materials and campaigns. Do you feel like there is anything that you have found is more effective or more successful than others? Any recommendations that you would have for our participants in their own practice?
Yeah, we had discovered that a few facts, it's very impacting. For example, the possibility of someone to die by drowning in a place where there's no supervision of a lifeguard, it's almost 6 times over. So it's very risky if you go to a place where the lifeguard is not present. And it's almost the same for the parents. For example, the most challenging thing we have on education programs is to convince people that drowning can happen to anyone. For example, on this on today, we have 31 participants, and I'm pretty sure that all of us have faced some struggle, some stress, or some distress on the water in one time life, at least. So what we have as a tool to the way out of this situation you have was that you can have, how to swim, to escape from this situation. And what we realize is that the most important tool that we can give to people is education. First, convince them that anyone can drown. And second, advice for the risk, advice for the tips that they can expect to get out of a situation. I'm not sure if I answer your question, but
Yes, thank you. Any other questions or comments from the group?
Yes, I'm Irma Ugalde. I'm a pediatric emergency medicine physician. Thank you for a great presentation. That was wonderful. Very inspiring. I just wanted to know, what has been your work and sort of the whole experience with the government, like, advocacy and sort of making things move from like, the top level down, because you could do so much as a physician, but how do you sort of move, people who can actually make changes, laws, et cetera?
Yeah, we have been struggling a lot on that. We learned that we were able to approve a few laws, but after approve the law, people have to accomplish or to obey this law. And it's, for example, for the range from 1 to 9 years old, 50% of the death drowning is at home, which tell us that it's very difficult to make laws to you for your home. And the best way to do that is to every year, which we do is every year we made a rounding report of the country, and we put on the media, we advertise, we send to the health ministry, we send to the tourist ministry, and we are being able to spread the numbers and make people afraid or frightened about the numbers, the urgency that we need to take actions. We need to call for actions, and a lot of them. Because education is the most powerful. We have to get in the house, convince people that they are at risk of drowning, their children, and not just on the pool, but on a bucket, on a laundry machine, on in other places around, in the water, around the water. I mean, in the house, around the house. So it's difficult, it's not easy. It's very difficult to convince in a world that many think is happening, and many are expecting that the world can end in a blink of the eye. It's difficult to them to pay attention to different issues. Thank you for asking.
I think one of the other things, it's Melissa Garrettson. I'm sorry, I'm an emergency physician as well. One of the things that I thought that your slide showed in your presentation was the impact of the cost of drowning, which may be more awakening or alarming to our legislators in terms of a pocketbook issue for them and how much money we spend caring for children who have drowned and the drowning deaths that occur as well. Might give us a little bit more of an entree into trying to make a difference if we couch it in that phrase, as non-heartfelt as that feels to all of us who care for kids. I think that's the language they speak in our country. And so I really appreciated your slide that had that information.
Yeah, that's exactly, Melissa, the reason we raise these numbers, because when we talk with them, we say, I want to just 10% of this amount. And if you gave me 10%, you're gonna save a lot of money and lives. But it takes time to them to be sensitive to this speech. But it will happen. I think it's happening, not the way, the speed we wanted, but it's happening.
Melissa, I appreciate that comment too. And you put a nice comment in the chat with some suggestions, and Dr. Chan as well. I know that TPS, David, that's our Texas Pediatric Society, really follows advocacy opportunities very closely and does a lot of work in the Capitol. When I was still in Texas, I testified on just what you were mentioning about, the pool fencing. We in the United States only have residential pool fencing laws in Florida and California. And that was something, that we have on the radar and had been trying to kind of start moving the needle. So I think, Anthony, just taking this back again to the Injury Prevention Committee and, for discussion and see what people feel like from the legislative advocacy climate might be good to try to, put on the agenda for future years.
Yeah, that's an interesting point. And Dr. Spillman, there's also a comment from Dr. Chan about, when we talk about implementing laws to, cause behavior change, right, for drowning prevention, you made an interesting point about we can create all the laws we want, but again, will people follow them, right? And so will there be penalties if they don't? Will there be, will it be looked at from that, a mindset or perspective? And so it's an interesting perspective that I necessarily didn't think of from that standpoint, that to put all of our effort and resources into something that may or may not cause behavioral change, right? From that standpoint, are we going to penalize certain situations or whatnot? And so there was a comment about could you implement a law, for example, in Brazil, in limiting the number of people in a beach to a certain number? Or what kind of specific laws or things have you looked into from that standpoint, from government or legislation?
Yeah, for example, when you think about changing behavior, we realize that this is the most strong, powerful tool we have. So we have invested a lot of money and effort and programs and material like comic books, cartoon videos, all to educate the children and make them fiscalization or a person that looks at the way their parents' is behavior, like we did on the car belt. That makes sense. Car belt. We have a lot of advertising about using the belt on the car, and that's exactly the way we are doing with the drowning stuff. So the drowning tips. We have this comic book for different environments. We have the cartoon book, cartoon video for different environment. We go to the fundamental school and we give a very brief class with our puppet. We have some puppet on the hand. We have some marionettes, and we give a class of 30 or 40 minutes. And they go to their house and say, Father, I can go to the beach by my own. I can stay away from you. I can get in the pool alone. You have to be with me. I can go in a pool without my cap, my swimming cap, and all the way, all this the small tips that we have planned. We have been able to pass them to the children, and they help us to educate their parents. And this is very, very worth it, I guess. But it's a long way. It's not a short way to do like a law that you establish and everybody is following. And I can answer you by if we create a law limiting, I don't think any politic people will establish or will think about a law limiting people to go to the beach, because the beach for us in Brazil is the most democratic way to have fun. So you can imagine that this is almost never will happen, a politician going that way.
Thank you so much, David. I really appreciate all of your comments, and thank you to the group for a great discussion. We're at time.